So today we'll discuss about airway management. Okay, so airway management is the single most important skill, especially who are working in the emergency, and it defines emergency medicine, which is quoted by Walls. So the airway anatomy, we start from the oral airway, okay, and then it goes to oropharynx, nasopharynx, and then as you see here, it goes to oropharynx, and here the hypopharynx, okay? Then down to the vocal cord, larynx, and the trachea. So this is the upper airway mostly. So when you go lower down, near to the vocal cord, okay? So here is the vocal cord, and then approximately the epiglottis, the valvula is visible, okay? The space between the base of the tongue and epiglottis. So these are the important structures, especially during intubation. So when is it required to protect or to intervene for the airway? So one is for patient who have snoring or an inspiratory stridor, and patient with paradoxical breathing and intercostal and sternal injury. So this is a sign of airway obstruction. So there are different maneuvers to intervene for a patient with airway problems. The first one is head tilt chin lift, which is mostly used for patient who doesn't have any injury, or for those we didn't suspect C-spine injury. The other is jaw thrust. Jaw thrust is a safe way, and it's mostly used for when you suspect C-spine injury. So as we see, the first one is head tilt chin lift. So one hand will be over the head, and the other will be on the chin. Okay, so you do head tilt and then chin lift. The other is here, you see jaw thrust. You're just moving the chin upward and to elevate how obstructed airway. The other is airway devices, which elevate functional airway obstruction, especially from tongue collapsing against soft palate posteriorly. So oral airway has different size and different shapes, and which is variable for different patients. As you see here, you measure from the angle of the mouth to the angle of the mandible, and then you will have different sizes. After you measure, you insert in two ways. There is nasal airway, which is better tolerated in semi-conscious patient, but is contraindicated in a patient with basal skull fracture, coagulopathy, fascial fracture, and you have to insert with lubricants. So here is the different types of nasal airways. So you measure the size from the nose to the tragus, and after you measure, you lubricate, and then you insert the way you insert in these two. And the last is the definitive airway management, which is tracheal intubation. It can be done by rapid sequence intubation, awake intubation, or intubation with deep sedation. Thank you.